is Obama fabulous on all counts. But he's also worked some of the people in his campaign better, all right, worked all summer actually on women's issues, women's health issues, and also violence against women issues. And I'm sure you all didn't hear it up here, but in near the time of the New Hampshire primary, which was last spring, he gave a really good speech that had a whole bunch of stuff on violence against women. And I think his selection of Biden as the vice president has also, really shows that that's his commitment. And of course, Biden says that the most important thing he's ever done in his life was pass the Violence Against Women Act. So we feel, like, whoa, things just could be really good if we weren't totally broke. That would be a problem. But anyway, other than that, first of all, I want to start out by introducing you to my grandchildren. And I know those of you that have heard me before were just dying to know how they're growing up. And the rest of you, you'll want to see and hear a few stories about them. Grace is the eldest. She's the dark-haired one on the bench with her cousin and sister, Sophie. Their mom is Christy up above. She's a pediatric nurse practitioner, of which I'm very proud. And of course, her husband, Nick, had to pass all kinds of domestic violence tests before he was allowed to join the family. Poor Christy, when she was an adolescent, she used to say, Mom, it's bad enough trying to find somebody to take an interest in me, but then I have to tell them what you do for a living. So then next door is my son, Brad, and his beautiful wife, Nadia, who dressed up like this for Halloween. They said it was the scariest costumes they could find. And she does look a little scarily like Palin, doesn't she? Anyway, there's a better picture of her next door. And Nathan is their son. Layla is the new kid on the block. She's about 9 months old. And Brad's whine when he was growing up was not only was he held responsible for never himself hitting a woman, but he was also responsible for none of his friends ever hitting a woman. And now that he's in the corporate world, he's responsible for none of his coworkers ever hitting a woman. And their chief charity, now that he's been there long enough to have some pull, is the local domestic violence shelter. So I think in terms of that's not only my kids and my kids' story, but it also reminds us that part of what we need to do as a community, and I love the theme of this conference, as a community, in order to keep women and children safe, we have to raise our sons to be nonviolent. Also our daughters, but particularly our sons. And one of the really fun ways to do it and an easy campaign to get onto is the Family Violence Prevention Fund, Coaching Boys into Men. Their website is endabuse.org. They have lots of free material, posters, etc. on coaching boys into men. And they have a terrific coach's playbook that's a really simple thing that coaches and other men that work with young boys can implement in terms of teaching lessons of nonviolence, as well as how to kick the ball, how to hit the ball, how to throw the ball. So it's www.endabuse.org. Look at Coaching Boys into Men. All right, from now on, I'm going to talk about the grim stuff. When we worry about safety for battered women, obviously the most extreme problem we have is homicide. And in Canada, at least 30 to 40% of women who are killed by a husband, boyfriend, or ex-husband or ex-boyfriend. That's from Stats Canada. It's undoubtedly an undercount. This is in comparison, though, to 7 to 10% of men who kill a wife, who are killed by a wife, girlfriend, ex-wife, ex-girlfriend. In the United States, it's 40 to 50% of women versus 5 to 8% of men. In terms of a ratio of women killed to men, it's 3 to 1 here in Canada, and it's ranged from 3 to 5 to 1 over the past 20 years. So it's always at least 3 times as many women are killed by an intimate partner as are men. However, whether it's the woman who is killed or the male partner who is killed, the history of domestic violence against the female partner occurs in the majority of cases. And so if you learn nothing else this morning, the number one risk factor for intimate partner homicide of men and of women in Canada and the United States is prior domestic violence against the female partner. Women are more at risk when they're leaving or have left. This was first noted by Margot Wilson and Martin Daly. Canadian researchers have been looking at this for a long time. The first 3 months is when they're most at risk. The entire first year, they are also in risk. But eventually, they will be safer. And that's one thing that we always have to remember, that eventually a battered woman, even though she is at increased risk for the first 3 months and the entire first year, eventually she will be safer. So it's up to us as a community, is it not, to take particularly good care of women in their process of leaving. And we also have to be very careful when we talk to the press, when we talk to the public, to add that piece about eventually she will be safer. Because if you read in the newspaper, you're a battered woman, that Jane Doe was killed by her partner in the process of leaving, and that's when battered women are most at risk, what's your take-home message? Is don't leave. So we have to be very careful as experts to add that caveat and to tell our reporters, you must add this phrase, eventually, after that first year, she will be safer, so that we get that part of the message across. The one before, women are far more likely to be victims of homicide, suicide than are men. Almost a third of the intimate partner homicides of women, both in Canada and the United States, are followed by suicide of the male partner. And that proportion may be increasing. And one of the issues in both the Canadian database and in ours, we don't connect those events. Suicide data is kept over here in this database, homicides over here. And those events are not connected unless we do things like fatality reviews where we get a more accurate account of those homicide suicides. Aboriginal and immigrant women are more at risk. We have the data in New York City, unfortunately, where we have both enough immigrant women and enough homicides of women to show that it is statistically significant that immigrant women are more at risk to be killed. But I think if that study was done in Toronto, we might be able to capture it also. Because of the isolation of immigrant battered women, because of all the barriers that they face, it makes it more difficult for them to escape an abusive relationship safely. Aboriginal women are also far more at risk, again, both in Canada and in the United States. And in our data, our femicide data, 44 to 47% of the women who were killed or almost killed by their partners were seen in the healthcare system in the year before they were killed. Only 4% were seen in shelters or by domestic violence advocates in the year before they were killed, but almost half were in the healthcare system. Now that 4%, only 4% were seen by advocates, probably if more of them had been, more of them would have been saved. But it also reminds us that no matter how much we do in our official advocacy system, there are many women who end up being killed that are never seen there, and the healthcare system is extremely important in terms of assessing for domestic violence and offering those women the advantage of services and safety planning. This is some interesting data from Bryan Valley, The War on Women, that just came out last year, looking at the proportion of women who are killed in comparison to law enforcement officials who are killed and soldiers that are killed. And so far more women are killed every year, and this was looking at data from the year 2000 to 2006, than either of those two categories. So we need to keep that in mind in terms of the importance of this issue. The other thing we need to keep in mind is that when women are killed by an intimate partner, children are also involved. First of all, in the majority of the homes where there were children In our femicide study, whether it was an actual femicide or an attempted femicide, close to more than half of them either witnessed the femicide or there was a child who was the first to find the body after their mom was killed or shot. Now, these are severely traumatized kids. And one of the things we also found was that only about 60% of the children who were in a home where their mom was killed received any kind of counseling afterwards. And even fewer of the children in homes where there was an attempted homicide actually received any kind of counseling. Now, these are severely traumatized children. And as we think about what happens in terms of our community, those children need to be reached out to in a systematic way. And in many communities, the children in homes where somebody is killed are reached out to, at least given a card, you can call this number for some services. Now, that's not, really connecting with them. But the attempted homicides, in our data, there were 9 attempted homicides for every 1 woman who was actually killed. And those children, there's really nothing systematic in most communities to reach out to them. And if you think about it in yourselves, in terms of what do we do for those kids, and what do we do for the people that are trying to take care of them after this event occurs. We also found custody battles, all kinds of issues for these kids after there was a homicide or attempted homicide. Some of them moved from their home, some of them ended up with their mother's kin, some with their father's kin, the one who killed or almost killed them. Some of the kids were split up between different homes, which is tough on them. And the attempted homicides, we found that they ended up not with other families, but oftentimes moved from the home, which is another disruption in their lives. And as I mentioned, we found the services for children who witnessed this intimate partner homicide and attempted homicide to be very fragmented, very difficult for these families to get in touch with. In our data, we also found that 83% of the cases, either the woman or the perpetrator was seen somewhere in the system before she ended up being killed. And so it wasn't like these families were totally secret to us as a community, but it was more that we were unable to identify them appropriately or offer the services that they need. These women called the police. They had some sort of police contact. It oftentimes did not end up in an arrest. As I mentioned, the medical visits, substance abuse treatment. Some of these women were in substance abuse treatment. More than half of the batterers who killed or almost killed their partners had a prior arrest. In Canada, from some other data, 30% of spousal femicides, there's been prior police contact. Mental health care system. Now, this is an arena we don't do very well in terms of identifying perpetrators. And only 12% were actually seen in the mental health care system, but 36% of the perpetrators were described as being in poor mental health. In Canada, 17% in official data of the perpetrators of intimate partner homicide are suspected for having some sort of mental or developmental disorder. Substance abuse treatment is another place where these perpetrators sometimes are. And we don't do a very good job of identifying perpetrators of domestic violence in substance abuse treatment when they come in that way, even though we know that's an issue for many batterers. And almost 9% of these men had been reported for child abuse. So they were known to the Child Protective Services. So these cases were somewhere in our system, but we failed to address the problem. And this is just in some graphic format, the same data in terms of the perpetrators, the abusive ones versus the non-abusive ones, the abusive ones being more likely to have been seen in the criminal justice system. And these are the victims, those that were abused versus no abuse, but again, the physical health care system being the most important part, as well as having called the police and being seen in the mental health care system. So when we think about spousal homicide in Canada, The boyfriend-girlfriend category is increasing. The rest of the categories of intimate partner homicide are decreasing. Same-sex intimate homicides, that's another really undercounted arena. I looked in the Stats Canada. Officially, there's only been 6 since 1997, in comparison to approximately 75 per year heterosexual. I know from hand counts in the United States that same-sex intimate partner homicides just don't get reported as such. It's one of those hidden issues, so I bet you anything it's higher in Canada. In terms of the rates, according to province, the BC and Manitoba are tied for 3rd. This is something you don't want to be, up in the top 10 on. So your rates aren't the worst in Canada, but they're not great. And as I mentioned, if there's 8 to 9 attempted femicides for each femicide per year, in BC, if there's an average of 13 femicides per year, that means there's somewhere around 100 other women who were almost killed by their partners each year. And again, I challenge you, do you know who those women are? And one of the things we found that those women who were almost killed by their intimate partners, although they were given excellent medical care, they were not referred for domestic violence services, even though it was no newsflash to the healthcare system that they had been hurt by an intimate partner. We had a woman down in Harborview Hospital down in Seattle who was shot in the back by her husband. And unfortunately, when she finished being in Harborview Hospital, which you know is a very terrific trauma hospital, they saved her life, but she was paralyzed. And she went on from there to a rehab center for about 9 months. And then she was discharged to her husband, because even though he shot her in the back, he pled down to aggravated assault and only did 2 months jail time and probation. And she thought the best thing would be to be in with him afterwards, because what she told us is she knew that he would take care of her, that he was really sorry, and it was a chance for her to keep the family together because they had small kids. Again, when we looked at their health care record, this woman was seen by a gazillion wonderful social workers, nurses, physicians, psychologists even. She was diagnosed with depression, but it was assumed that it had to do with her rehab struggles rather than the domestic violence. She was never referred to domestic violence services. The child who had witnessed her mother being shot was never referred to any services. It was all about, physical rehab. So it's interesting in terms of us not paying attention to these attempted homicide victims and the children who are part of that. The Ontario Death Review, which has been sort of the longest fatality review that's gone on in Canada, found that in 21% of the spousal homicides, it was a custody or access dispute that was part of the underlying issue. And also, in terms of children being involved, women are also pregnant when they get killed. 10 of the 342 women were pregnant when they were killed that they reviewed in the Ontario Death Review, and 7 of those 10 were killed by a partner or an ex-partner. What we say in the healthcare business is intimate partner homicide is the new face of maternal mortality. That now we're finding that now that we give great OB care, great prenatal care, women seldom die in childbirth from natural causes, but they oftentimes die when they're pregnant or immediately after childhood from an intimate partner. So, the stuff that you can pat yourself on the back for, look at that nice downward trend in terms of intimate partner homicides in Canada since 1974. We've actually looked at research in terms of what's been the cause of these downward trends in the United States, and we found that good laws, good domestic violence resources makes all the difference in terms of women being less likely to be killed. In the States, we've also gone down, but what's interesting in this graph in Canada, the female victims rate has reduced the most in Canada, while in the States it's been the male rate. And where we started out, and this is who gets killed. So men are less likely, far less likely now to be killed by intimate partners than are women. We think that the battered women in the States finally feel like, that there are other resources they can go to besides killing him, that killing him is not the only way out. But that's been part of the interesting differences between the states and Canada in this. In the United States, we don't count ex-boyfriends well. We've got almost 20% of the perpetrators of intimate partner homicide being an ex-boyfriend. That other category is same-sex females. So again, a category that oftentimes gets overlooked, and we did publish an article specifically on those cases as a case study. So as I mentioned, one of the reasons why we've seen the decline, at least in the United States, and research like this hasn't been done in Canada, has been around improved domestic violence laws and resources. Also, exposure reduction, where there is increased female earnings, lower marriage rates, higher divorce rates, there are fewer women and men being killed by intimate partners. That doesn't mean that divorce is a good thing. It just means in places where women feel like they have to get married at a young age, that that's the only way for them to have a good life as a woman, and places where divorce is very difficult to obtain, all of those things tend to keep women stuck in abusive relationships. The other thing that's made a big difference in the States is we've done something about the gun availability for batterers, not as much as we should. And also in Canada, one of the things that's interesting, although the rates of women being killed with firearms has decreased, it's still women are far more likely to be killed by firearms in Canada as by other methods, and far more likely to be killed by a firearm than are men. Again, the increase in domestic violence laws and resources over the same period that we've seen the decrease in intimate partner homicide. In Canada, one of the other things that you can look at is in terms of relationship status, that we have a higher proportion of common law women or common law couples being killed in a spousal homicide relationship. And when you look at it proportionately, you also see that not only common law, but also separated couples. For women, being separated is the most dangerous marital status category, although boyfriend-girlfriend is also right up there. All right, in terms of an overview of risk assessment, this is my tribute to baseball. I know we've stolen most of your baseball teams, and I'm sorry about that, but it's still a good sport, and Yogi Berra has some interesting things to say. When I first developed the danger assessment, and the danger assessment, those of you come the breakout this afternoon, you get far more stuff on that. But the danger assessment is a risk factors for homicide instrument that is centered on the victim. It's all about helping her see a realistic appraisal of just how much danger she is in. And so when I started working with the danger assessment with battered women way back in the early 80s, I developed this danger assessment based on research with homicide. I developed the wording based on what women said was the best way to ask about these things. And then I started using it in my own work with battered women in the shelters I was working with, and gradually it's moved out further than that. And everybody always asked, what's the cutoff? How many of these risk factors means you're really at high risk? And I didn't really have the data to back that up. Everything I'd done was on retrospective studies. And so I decided that I needed to get into the risk assessment business, even though I had never thought about that. I needed to go get a PhD so I could learn the stats, so I could figure out how does one predict which abused women is most at risk. As I was working on it, so were other people. Here in BC, you guys led the pack with Randy Kropp and Stephen Hart's work on the SARA. And at this point now, there's a very high demand from all of our systems, criminal justice, the advocacy systems, the healthcare system, for a really good risk assessment. My friends, the emergency room nurses, say, what we need is a 2-item, no longer than 2-item, 100% predictive, 100% accurate way of determining which battered woman's at most risk. And I'm like, yeah, well, don't hold your breath. It's not going to happen that way, but we have done a lot of work in the area. One of the things that's come up in the States is there's been a couple of lawsuits against probation departments for failing to accurately assess the risk in a batterer, because the instruments we use for general assessment of risk amongst probationers doesn't work very well for domestic violence. At least there's a lot of controversy around that. So that's one of the issues that's going on right now. Another one of the issues, especially in domestic violence homicide, is it doesn't happen very often. Compared to the huge numbers of battered women, thank goodness, relatively few get killed every year. So it's always hard to accurately predict a very small number from a very big number. It's a relatively young science. We've only been really doing the kind of research we need for risk assessment over the past 5 or 6 years. And there's also 4 interacting parts to consider. There's how accurate is the instrument, but there's also how knowledgeable is the risk assessor. You know, is it a clerk that's checking off things from a list and adding them up? Or is it someone who's bothered to come to a conference like this to learn about these issues and really is knowledgeable in the domestic violence field? There's also one specific potential victim, and it matters what she does. And it also matters what the system does in terms of keeping her safe. So as I'll talk about later, we need to think about safety assessment as well as risk assessment. There's a lot of fears that risk assessment will be used to limit services to victims, and I share that fear. And I say that we need to be really cautious in doing that, and when we do, we need to use validated instruments. And there's also high stakes for both false negatives and false positives. The other thing we've learned over the past 5, 6 years in doing this work is that risk assessment is usually talked about in terms of risk of reassault in domestic violence cases, a risk that a domestic violence incident will happen again in that couple, while lethality assessment is the risk of a homicide or a near fatality. Now, although those risk factors are overlapping, they're not exactly the same. And that's one of the things that has emerged. We thought they would be exactly the same, but the strength of those risk factors, how they operate, are somewhat different. And I'll talk more about that if you come to the session on the danger assessment. The other area that we need to think about very carefully is the safety assessment. And that's both in terms of community safety assessment as well as in terms of the individual woman and what she does to keep herself safe. And safety planning, which is the cornerstone of what all of we do in terms of domestic violence advocacy, we don't really know for sure on the basis of evidence what strategies in safety assessment work best and what format of safety assessment works best. So that's an area we certainly need to look at. So I know this is probably more than you ever wanted to know, but if you're thinking about, okay, what risk assessment instrument do we want to use in our community, in our agency? The way the risk assessment instruments are evaluated is using what we call a receiver-operator curve. Now, I could explain to you what that means and where it came from, but it would take too long. So just trust me, receiver-operator curve. For whatever reason, that's what they call it. And it's a combination of sensitivity, which is the true positives. That's when we predict violence. We say this is a high-risk case, and indeed something terrible happens. And if we go false positives, that's what we call false alarms. That's when we said it was a really dangerous case, and nothing happened. Now, the ROC curve is a combination of sensitivity and specificity. The specificity is the true negatives. That's when we say it's a low-risk case, and indeed, it is a low-risk case. That's when we're accurate about that. Now, the false negatives is what keep us up at night. That's what worries all of us. That's what, if we were to say it's a low-risk case, and we wake up the next morning and look in the newspaper, and something horrible has happened. And that's where I started in terms of trying to develop the danger assessment. Now, one of the other things to think about is we used to say to every battered woman, you could get killed. You are at risk to get killed. And remember I said 15 minutes ago, the number one risk factor for intimate partner homicide is prior domestic violence. So that was indeed true, but we were overestimating risk to a great deal when we do that. We have a lot of false alarms. There are gradations of risk of homicide. So this is an ROC curve done with a danger assessment. This was just published in the Journal of Interpersonal Violence. And what we found was we used our femicide data to calibrate the danger assessment. It's a case control study to see which were the risk factors that were the strongest. And then we tested it on the attempted homicide victims. And we were indeed able to capture 90% of the cases. So that's a really impressive ROC curve. Now, caveat, it's a case control study. The most rigorous kinds of tests are prospective studies, when you give a whole bunch of people a risk assessment instrument and then you check them in 6 months or a year and you see how many of them were reassaulted or killed. Now, the problem is with homicide, my wonderful friend, a statistician, said what you would need to do, Jackie, is give the danger assessment to 10,000 women. Then you would need to follow them 10 years, and you can't give them any intervention because that would, mess up the experiment. And you see who ends up being killed. And I'm like, that's not going to work. So that's, not only is it unethical, nobody's going to give me the money to follow 10. So never mind. So what's our compromise? So we compromise with the case control study. So it's a little bit easier just statistically to get a higher ROC curve, to capture more of the cases under the curve in terms of sensitivity and specificity with a case control study. So I'm not going to talk about this for very long. The PowerPoint is available to you on the conference materials. You can look at that more. But just to show you very briefly where we are in terms of existing risk assessment instruments, what kinds of ROC curves we have on them. As you see, the ODARA, which I'm sure you've heard of, that was developed in Ontario right now, is it's the new kid on the block, and it's the best ROC curve for a prospective study of reassault. The danger assessment for reassault was 69%. Now, in terms of interpreting these ROC curves, 50% would be what you get by chance, just by luck of the draw. So obviously it needs to be higher than 50%. We would love it to be 100% accurate. We aren't going to get there. Right now we're feeling good about 70 to 80% accuracy under the ROC curve. You see the danger assessment in terms of risk of reassault was only 69% accurate. That was when I looked at the data and I said to the statistician, couldn't it be 69.5? Or 69.6, so we could kind of round it up to 70%. That looks so much better. But that's what it is. And what we found was that though for attempted homicide and actual homicide, we have a much higher ROC curve because that's what the danger assessment was intended to do, is to help her identify her risk of being killed or nearly killed. The other risk assessment instruments, except for DV Mosaic, which is a computerized one, but it's kind of expensive, were designed in order to identify risk of reassault. And they're designed to be used with other, that they don't have to, in fact, many of them generally don't have the victim involved in doing the assessment. The ODARA, for instance, all of the information can be gotten from the police reports of an assault. Okay, I'm going to just briefly breeze through a couple of things that I think it's really important to know. The homicide-suicide cases in our study, one of the things that we found was that the homicide-suicides, there was very little evidence of mercy killings, even amongst the elderly, the older battered women, which is oftentimes what people think it is that, he kills her and then himself because one of them is sick or she wanted it. There's very little evidence of that when we talk to family members. Even in older women, there was prior domestic violence in 32% of the cases that we could identify. 79% of the cases of younger women. But there was 49% of the older women were afraid of their partner before she killed them. And like I said, the family members said, this was not a mercy killing. She didn't want to die. He was the one that left the note that said, that they had made this pact, that they were both going to die. Significant risk factors for the homicide-suicides: unemployment, again, partner access to guns, used in 61% of the homicide-suicides in the States, and the same proportions in Quebec in a study that was done there. Threats with a weapon, forced sex as a risk factor, a stepchild in the home. This is her biological child, not his. Again, Wilson and Daly were the first to identify this. Now, this doesn't mean that blended families can't work. What this means is that for an abusive man, because these are risk factors over and above prior domestic violence, for an abusive man, that stepchild is a daily reminder that she was with someone else once. And you know how highly jealous batterers can be. Highly controlling perpetrators, also estrangement, women having left before he killed her. What was unique to the homicide-suicides was the partner-suicide threats. He had threatened to kill himself before he killed her. And a lot of the family members that we talked to said, yeah, he threatened to kill himself, but we just thought he was trying to manipulate her. And indeed, I've heard domestic violence advocates say that. We have to be very careful. People do not threaten to kill themselves lightly. Neither do they threaten to kill other people lightly. We always have to take that seriously. And he does say, if you leave me, I will kill myself. But what batterers will do is he'll take her with him. There was a recent newspaper report of a homicide-suicide in LA. It was said that this was the first of the the new depression-related suicides that had occurred. This guy had an MBA. He was unemployed for 6 months leading up to the suicide. It happened to happen when the stock market was crashing. So, the idea was this was a suicide related to the stock market. And actually, he also killed himself and killed his wife and 3 adolescent kids before he killed himself. And I'll bet you anything there was prior domestic violence in that case. But we want to think it's something else. This is a classic domestic violence homicide-suicide. And odds were there was prior domestic violence, but they never even looked for it. It was assumed that it had to do with the economic problems. These men are a little bit more likely to be married, and oftentimes she leaves him because he's abusive. Then he seeks help in the mental health care system because he's distressed and distraught, because my wife has left me. And because usually our psychologists and psychiatrists don't know to ask him, did she leave you because you were beating her up? Now, that may not be the right language, but we do need to find out a way to find that out, and a way to get that information to our mental health community. And I know I don't have time. I want to say one thing about strangulation, another risk factor for intimate partner homicide. But women don't say, he strangled me. What they say is, he choked me. So we can't ask women with the strangle words because that's the stranger in the night. But we need to ask her whether or not he choked her. So that's one of the things that definitely increases the chances of an intimate partner homicide and an intimate partner homicide-suicide. So we need to be sure that we're prosecuting strangulation as a felony or a major crime versus, oftentimes in the States it's classified as a misdemeanor because you can't see any real problems. We also need to make sure these women get immediate medical attention. Our first responders need to be trained that if there's been a choking, that she is immediately sent for medical attention, whether or not she thinks she needs it. The chances of her dying or experiencing a massive stroke are severely increased in the next 24 to 48 hours. And she also may develop pneumonia and die of pneumonia from swallowing her own vomit, because vomiting afterwards is something that oftentimes happens for women. So the line has to be, for first responders, did he try and choke you? Because she may not remember it. Remember, there's anoxia to the brain, not good for the memory cells. So she may not exactly remember it, but so she needs to be asked whether or not she was choked, and if she was, she needs to be sent immediately for medical attention. That way also we can get a good documentation of the results of strangulation. I want to end up with this RAVE study. This is one that we did risk assessment with women in New York City and LA. We gave them 4 different risk assessment instruments. We didn't give them a score on any of them, but they figured out that the more times they said yes, the higher danger they were in, because we asked them a bunch of questions and we said these are hypothesized to be risk factors for domestic violence occurring again in your case. A bunch of the women, when we looked at the qualitative data, said something like, I never knew. I never knew how dangerous it was. This makes me much more resolved not to go back. Another bunch of women said, I'm going to go get that permanent thing. In the States, we have the short-term order of protection and then the long-term one, and they oftentimes call it permanent. She said, it's a lot more hassle. I wasn't going to go through all that hassle before, but now I will. Now I know that I'm at high risk. I said yes a whole bunch of times. Another bunch of women said something like, he's really dangerous, isn't he? I keep fooling myself about that. Women understand deep down underneath that they oftentimes underestimate their risk. And another bunch of women saying, I know he was scary, but no one believed me. I'm going to keep pushing the system now. We've also been using the danger assessment widely in Alberta, and we've been keeping data from it. And one of the women in Alberta said after doing the danger assessment, it was like filling in a piece of the puzzle. I could finally see the whole picture. Then the last thing from this data I want to show you is what protected women. Because remember that safety assessment piece? Okay, what made her less likely to be reassaulted? And in these slides, the yellow are the significant factors. Those are adjusted odds ratios. So what you can see is that going someplace he couldn't find her actually increased her risk of being reassaulted. Now, these were the severe batterers. These were the dangerous guys. What happened in these cases, she said, I'm going someplace he can't find me, but eventually he did. He stalked her, he followed her, he got a sister to tell her, or with child custody exchanges, he eventually figured out where she was. Now, if the odds ratio is on the right side of the decimal point, it's protective. Going to a shelter significantly protected her from being reassaulted. This is really strong, good data showing the effectiveness of shelter. And the abuser being arrested for the time one incident also protected her against reassault from a dangerous perpetrator. Now, for the minor to moderate reassault, again, shelter is protective, so is no voluntary contact with him. The medium range batterer, the not really, really dangerous one, is deterred by her staying away from him. Getting a temporary order of protection also was protective. But again, shelter was the strongest protection. And finally, from stalking, everything increased her risk. All of those strategies, because when she leaves him, the stalking happens, the text messages, the constant harassing, the phone calls, the following her. Going someplace he can't find her, then he says, well, I had to follow her to work because she wouldn't tell me where she was. So that's where the stalking comes into place. So we have to be sure to think about stalking as an area of domestic violence, recognize it as a risk factor for reassault and homicide, and also think about ways we can protect her as a system from stalking. So, let me show you just one more thing. Unsupervised visitation with these women, 73% of these cases, even though these were known domestic violence cases, they were known to the courts, they were known to the systems, they were documented domestic violence cases. Even so, unsupervised visitation was ordered in 73% of the cases. And in 24% of those cases, of all of those cases with supervision, the contact for exchange of visitation was an opportunity for physical abuse, threats, and intimidation. So that's another area of risk we as a community need to think about how we protect her. So I always have more to say than time to say it, but I'm going to end here. When we look at our whole system process around risk assessment, both risk of reassault and risk of lethality, if we go down the offender side, offenders are found, yes, in the criminal justice system, also in batterer intervention programs, also in mental health settings, also in substance abuse treatment. In all of those places, if we're going to keep women safer, we need to identify men who are abusive and do some sort of risk assessment. So that would be risk of reassault. We can use the SARA, we can use the ODARA. Any of those that are meant to be used for risk of reassault are very appropriate in those settings. Now, one of the things, at least in the States, that doesn't happen very often is, are the partners notified of the results of that risk assessment? If he is determined to be at high risk on the SARA, on the ODARA, is his partner notified of that high risk, or do we keep that information in the criminal justice system? That's a question for us as a system. She deserves to be notified. And oftentimes those partners are not being seen by advocacy services. They've been given the opportunity to be seen. They may have even been called, but they're not necessarily in ongoing contact with advocacy services. So they deserve to know about the high risk if it occurs. That information on batterers goes to the judicial system. Now, the other way is using, for first responders, when an incident occurs and the police are called, using first responders using something like the Be Safer, or in the States we have the Maryland lethality assessment. They're both short risk assessment instruments, can be used very briefly with women. What's important is the protocol that goes with them. I'll talk more about that in my session. But what we use the Maryland lethality assessment for is to get her in touch that moment, that night, the time of the call, with advocacy services. So we have a protocol that goes with it for the high-risk cases. Women in shelters or the healthcare system need to have done with them some sort of risk of lethality. As we found in our study, only about half of the women who were killed or almost killed accurately saw themselves at that much risk. So women almost never almost never overestimate their risk, but often underestimate their risk. So something like the danger assessment done with them so they have an accurate appraisal of their risk. Then, if she wants it to, that information may go to the judicial system. But what we do is we keep it confidential unless she wants it to go to child custody cases or go to some sort of official court action. And then finally, at the bottom, a very important piece of it is a system safety audit. If you were going to hear Ellen Pence today, you would hear her talk about the safety audit that's done for agencies. It's an excellent one that we can use in order to determine whether or not our system is keeping women safe. Fatality reviews is another way that we determine how well our system is keeping women and children safe. And that information needs to feed back up to both our shelters and our judicial system so we can improve the way we operate. I thank you very much. And I promised one of the women in the study, one of the moms, that I would always end that way. It's a pleasure to be here.